Welcome to the first episode of our series about health and climate change. Now, the World Health Organization sees climate change as the single biggest health threat for humanity, be it through air pollution, extreme weather events, heat waves, floods, the disruption of food systems, the expansion of zoonotic diseases, which could also trigger more pandemics, and we all know just how disruptive that is from COVID. But climate change is also bringing more food, water and vector-borne diseases and mental health issues, which are often overlooked. And this list, it isn't even complete. And then there are, of course, also the financial costs as well. You know, reports from the US show that the price of healthcare costs attributed to climate change and fossil fuel use is at least $820 billion each year. And that's in the United States alone. Just let that sink in for a minute. $820 billion per year. That's more than the total annual US defense budget. And the Americans spend more than any other nation on this planet on defense, by the by. But coming back to the toll on our health and lives, according to the WHO, climate change impacts are already claiming the lives of 13 million people every year. That's almost a quarter of the annual average global death toll. And this is just the start. If we fail to achieve the Paris climate goals, we could see an additional 250,000 deaths per year for the period 2030 to 2050, according to the WHO.
I'm convinced that the numbers are even higher, because on documents that document the deaths, there's not written heat. The cause, there's always written only stroke or heart attack. So the real numbers are much higher.
That's Professor Claudia Traidl-Hoffmann. She's the head of the Department of Environmental Medicine at the University of Augsburg and one of Germany's leading experts on the topic of climate change and health. And we'll be kicking off this series with her in just a minute. But first, let me introduce the topic of this first episode. And this being the first episode of the series, we'll start at the beginning. We'll start with heat. Why are an additional 2 degrees Celsius so dangerous for our health? What's the big deal? That's what we'll be looking at in this episode. And it's time now to bring in Professor Claudia Traidl-Hoffmann. She's not just one of Germany's leading experts on health and the environment. She's also written a best-selling book on precisely this subject titled Überhitzt, which translates as overheated. And she's among those medical experts that are sounding the alarm that we are in the midst of a global health emergency and we haven't got any time to lose.
It's influencing our brain, our heart, our stomach, our muscles, and our skin, our lungs. So every organ is influenced by climate change and by different aspects of the climate change. But the biggest threat for our lives also is heat.
I mean, let's say we miss our climate targets of keeping, global warming below 2.0 degrees by 2050. Let's say the planet heats up by 2 to 3 degrees by then. For somebody who hasn't got a clue about global warming and all its ramifications, this really doesn't sound like a lot, right? Some people, especially those who have money, they might say, well, a couple of degrees warmer, better summer holidays, and if it gets too hot, I can always switch on the aircon. Can you perhaps explain why rising temperatures will also be a problem for these people?
Yeah, because 2 or 3 degrees in average means for cities, for example, 10, 15 degrees. And when you imagine to be in Berlin or Paris or New York or any other big city in the world, 10 or 15 degrees more means more deaths. So more diseases. So people will not be able to breathe anymore in cities. And where are people living also even more in the future is in cities. And to this comes the fact that we have the air pollution in the cities. And air pollution with heat, with UV radiation means that we have other chemicals also in the air, so that are threatening even more our skin, our lung, our mucosal surfaces. And this really means that this 2 or 3 degrees in average means much more for the people in reality at tipping points, when it's hot in summer. We saw it now in Canada, or now at the moment also in Africa, that we have really this enormous heat waves. And these heat waves, they are becoming much more often.
And this is something, that our bodies can adapt to? Because we are very adaptable, aren't we? Or is this something where we're very limited because of our core temperature?
You're right. So the human body is adaptable. And we know that also people are living in areas where it's really hot. However, our body has limits. So climate resilience is the way to go, yes, but our body has limits. And I give you one example where it really becomes clear that we have limits. I tell you the story of a roofer that was working over the whole day on the top of the roof, and he was working there, and it was really hot, and he was not drinking enough, he was not wearing a hat. And he was coming to our hospital after he was almost unconscious. And he was coming into our outpatient clinic with a core temperature of 43 degrees.
Oh my God.
And he was dying within hours. We didn't get him back.
And he was
was dying.
And he was a fit man.
He was fit. He was a fit man without any diseases, heart or lung disease. He was a fit man. And this exactly shows that we have our limits. And this is one reason, and the most important reason, why we have to limit climate change, because the Earth, as it is today, is perfect for us as human beings. And it has to stay like this because we have our limits in adaptation.
So perhaps if we look into a bit, on who are the most affected and who is going to suffer the most in future.
Yeah, so I give you some examples also from my daily clinical practice. I'm dermatologist and allergologist, and I'm treating patients with chronic inflammatory skin diseases. One skin disease I'm treating is atopic dermatitis. This is a disease where the skin is inflamed and it's itching like hell. Yeah. And I have patients where the whole skin is full of this eczema. And when heat waves are coming, I have patients that are thinking about suicide. They cannot stand the itch, they cannot sleep.
The mental health aspect is also something we will be looking into in one of our episodes. We'll be devoting quite some time to that. But also in your book, you also listed, diabetics or people suffering from dementia or MS or with kidney diseases. Can you perhaps explain a bit also the connection there to, heat?
Yeah. So mentioning this, we always have to think that everything is with everything connected. This Humboldt thinking, Alexander von Humboldt already said this, everything is with everything connected. And when we think about the effect of heat on our body, it's the same. As you said, it's also affecting our mental health in different ways. First of all, people with dementia, with Alzheimer, they have an exacerbation of their disease during heat waves. And in some ways, we do not always know the molecular mechanism on the cellular level. So we do not know all these facts. So this is something we have also to understand in research. However, we know these associations, that they have an exacerbation of their chronic disease. But mental health means also depression, means that people, especially young people, they fear the future. My own son, for example, 18 years old, he just last week, he told me, Mom, do you think it makes sense that I have children? So what will happen to my children? And so this is this fear for the future young people have. And my son is only one example of many people I see also in my outpatient clinic that are asking themselves what will be in the future. And to be honest, what we are doing at the moment, doing nothing, is a suicide of humanity.
That's what you just mentioned with your son. I have 3 young boys. I'm sure those questions will also arise with them at some stage. I mean, what did you say to your son? How do you answer that question?
I said, listen, yes, it may be that they have different times, but it's also how you act and what you give also to your children, how they will act and try to save this world for us as human beings. So this is important. So I suggested to have children, but to educate them as human beings that are respecting nature. And this is why I think people like my son have to have children in order to have educated and mindful children and human beings in the future.
Children are very susceptible to, the rising temperatures as you laid out in your book, but it's also the above 65-year-olds who are considered very vulnerable, when it comes to heat waves. I'm thinking of my mother now, for instance. She lives on her own, and it's always been a problem to get her to drink enough. She never really drinks enough. She likes coffee. She'll tank up on that. Yeah. But it's, with water, it's almost like you have to force it down her. And there is the risk that she could dehydrate without noticing. It's also something you describe in your book, where elderly people, they feel worse by the day. They don't know what the cause is. They call their GP. He says or she says, come in, and that could be the last trip that they make because they just die of exhaustion then. How great a risk is this statistically for elderly, the fact of dehydration or that they, might suffer a heat stroke?
It's extremely high. And this is exactly what we see also in our outpatient clinic. So, and the interesting thing is a heat wave. It's over several days. And we do not see these patients dying in the first day or also in our outpatient clinic. We see them after 2, 3, 4 days, the heat wave is acting, let's say. So it's really a delayed effect. They are dehydrating and the kidneys are not working anymore and they are dying. And normally they are, healthy ages. But this heat waves are taking them away and they could live for another 10 to 20 years or 15.
You also describe in your book how women tend to suffer more and also that there's very little science on this. So, I've got 2 questions on that. Why is it that women suffer more and why is there so little science on this?
So this is this gender gap we have in science and in general in evidence. So we know in general less and not enough about gender differences, not only about women, but also about men. So how drugs, for example, are acting differently in gender, in different genders. So this is something we know in general. We are not aware of this. I give you another example for mouse experiments, for example. There are some experiments, some animal experiments are done only in female mice. And nobody speaks about this. There's really a bias we are used to, but nobody really speaks about this, that we are investigating only in one direction. And this is something in science in general has to change. Why? But your question, why are women suffering more? So this is especially also in developing countries. We know that women are the ones that are at home at the cooking site, for example. They are at open cooking spaces with pollution the men are not getting into contact with because they're working outside, for example. So this is why women are in closer contact with polluted air and also with heat. Yeah. But as I said, the research is really needed. We have to go into also the molecular mechanisms. Why a special gender, so female gender, is more susceptible for specific diseases.
And there's also a more immediate threat, a direct threat, right, for women during heat waves, because you outline that aggression levels rise and there's more domestic violence because of it.
The heat is leading to more aggression, that's right. And then indirectly also to more aggression against women.
Mm-hmm. And if we look at also, pregnant women, the risks that they face over climate change.
So we have the premature birth, for example, is more often during heat waves. We know that also women are losing their babies also because and more often in heat waves. So exactly, pregnant women and unborn childs are also affected by heat waves.
There's also the aspect of treatment, the medication, which, I was also unaware of this, that, all medication is tested under normal temperatures, but global heating means that some of these, they may not work properly, or you may need to change the dose. How big a problem is this going to be for us?
Extremely high. And it's, again, will be a problem, but is already at the moment during heat waves, because also the medical doctors, they are not aware of this yet. So when you speak with medical doctors, whether they change something in the medication during heat waves, most of them would say, no, why should I? Because they are not aware of this problem. This is why I wrote now together with medical doctors the first book for medical doctors concerning planetary health, where really the surgeon, the internal medicine doctor, they are writing what climate change means for their discipline and for the patients in their discipline. And we do not even have big studies investigating the impact of heat on multiple drugs. So when you imagine your mom, for example, I suppose that she's taking not only one medicament a day, but 10 or sometimes several ones. So the interconnection and of these drugs, what is happening during heat, we do not know. And we have to do also here more research on this. Pharma industry is not taking into account environmental impact on their clinical studies. So who is showing results of clinical studies and saying, okay, you see, we have now here this result, and perhaps we had an influence of the heat wave. No one was doing this.
It's kind of worrying. Perhaps if you had to sort of break down now, all we've talked about so far regarding heat, what are the main solutions, or what are the main measures we would have to take, within the next 5 years to address this properly?
So we have to have really good heat alarm plans. So we have this already in France. So this is something we need also in Germany, and we need this in all the countries. And this can be also quite detailed. So, for example, the mayor of a small town has to know where the old people are living in roof apartments, for example, where they have a high risk of overheating during these heat waves, to save them, or then also to catch them and to bring them to areas where it's colder. So this is something we have to do. On the other hand, we have to change how we are building cities. Also for this, we need further research, but we know already what we need. We need green areas that by cooling down in a natural way the cities. We have to bring the cars out of the cities in order also to reduce pollution in the cities. So this is something we have to do immediately, and we have no time now to say, okay, this will cost a lot of money. This aspect of this costs a lot of money is incredible, because it will cost us much more when we act only in 5 or 10 years. And at the end, it will cost our lives. And this is how we also can convince the people in the governments and the rich people when it's about their health. Because it's not only about the health of the people with low socioeconomic status. It's about everyone. It's about the children of everyone in the world. And when it's affecting health, I think this should convince people to do something, because it's not the iceberg that is dying, it is us. And this is why we can convince by this aspect of climate change and health. I hope that we can convince people that we have to act now.
Professor Claudia Traidl-Hoffmann, thank you very much for joining us here with On the Green Fence. We do appreciate your time and expertise.
It was my pleasure. Thank you very much.
Okay, so time for my main takeaways from this episode. First off, heat is a killer that needs to be taken way more seriously. Prior to this episode, I must admit, I did underestimate just how severe the impacts are and how comprehensive. I thought, okay, if it gets hotter, we just need to drink more, take it a bit easier, and we'll be all right. But as Claudia Traidl-Hoffmann stressed, we won't be all right if we miss our climate goals, and nobody will be exempt if we carry on like this. Especially people in cities will suffer. But even if heat doesn't kill us outright, there are very adverse impacts. It reduces our brain power and productivity, costing our economies billions every year. And I found one study that estimated that if the world heats by just 2 degrees, the annual global loss in labor productivity would be $1.6 trillion US. I mean, that's a figure I can't even fathom that figure. What else? Yeah, I also thought it, very worrying that all this is impacting on our medication, and that we may in fact be over or underdosing because of it, because all this medication is being tested under certain temperatures, and it doesn't account for global warming. And this is, very worrisome, I think, also for people with chronic diseases who need to take tablets on a regular basis. And on top of that, also that according to Traidl-Hoffmann, doctors or GPs themselves often know next to nothing about this problem. That's also very worrying. But luckily, experts like Traidl-Hoffmann are sounding the alarm, and they're calling for swift action to draw up national health emergency plans over climate change, something that is actually missing here in Germany right now. But the bottom line to all this is that the single most effective measure to keep our planet healthy, and with it us, is to stop burning fossil fuels and get to net zero as fast as possible. Every kilogram of CO2 we emit, every trip in the car or plane, every beefsteak, every pair of jeans we buy, isn't just driving global warming. It really is impacting on us, on our health, and on that of our children. And it's all connected. And it's not just those with chronic diseases or the vulnerable groups that will suffer in the future. I don't know, it also struck me doing this episode that, when you go to the gym or you do sports, it's often about shedding pounds, and we regularly take stock of what we've achieved, by climbing on the weighing scales every week or every day even. And this, undoubtedly, it's good for our health, working out. But given what Traidl-Hoffmann said, maybe, it would make sense, or even more sense in terms of health, if we translate this gym weighing scales mentality into how much CO2 have we managed to save every week by not using the car for work, or opting for a veggie option, or not buying the third or fifth pair of jeans that we don't really need. And, of course, there are calculators online that will give you the precise CO2 amount you've saved by doing this. I think probably most of you listening to this are doing this already, but yeah, I'm sure there's always room for improvement. I can certainly improve on this, that's for sure. Anyway, I don't want to get too preachy now. That's my 2 cents for the time being. Looking ahead to the next episode, given that health is something that we all tend to worry about to varying degrees, doctors, they are uniquely positioned to get the message across, that health and climate change are inextricably linked. But how would patients feel about their GPs mixing medicine with environmental matters? Would they be comfortable with that? So in our next episode of our series on climate change and health, I'll be talking to a rather unique general practitioner here in Germany who hasn't just introduced so-called climate consultation hours for his patients. He's also campaigning to reduce the carbon footprint of the medical sector as a whole, which accounts for roughly 5% of the world's total emissions, by the way. So do join me for that. It should be interesting. In the meantime, I hope you have subscribed to On the Green Fence wherever you get your podcasts, and also are sharing it via your social channels. And if you can find the time to write a short and sweet review on Apple Podcasts, I'd be very, very grateful. That's about it. Many thanks to my sound engineer Jürgen Kuhn, and a big thank you, of course, to you for listening to this episode of On the Green Fence. I hope you took something away from it, and if you did, please do write me an email at onthegreenfence@dw.com. I'd really love to hear more about what you feel and think. My name is Neil King. Take it easy and take care. On the Green Fence.